But in your workbook, I'd like us to pay special attention to medications. Medications, the very things that are supposed to help you. In fact, I call attention to psychiatric medications in particular. Why? Because it turns out that at least a couple of classes of psychiatric drugs, antidepressants and antipsychotic drugs, which are notorious for reducing sexual performance. And in your workbook, I show you, just very, very simply put, antidepressant drugs and antipsychotic drugs can lead to hormonal and neurotransmitter changes and a lot of emotional blunting, right? Flattening of the emotions that then cumulatively bring about sexual dysfunction. And how interesting. Take depression. When we talk of clinical depression, at least, right, today, if you opt for psychiatric meds, you're very likely to be prescribed what are called SSRIs, right? Serotonin reuptake inhibitors. Selective serotonin reuptake inhibitors. What do? They're supposed to increase the serotonin in your brain, supposedly associated with feeling happier than feeling down. Now, I say supposedly because the data recently that have been coming out through meta-analysis suggests that there's a lot of variability across people. In any case, let's assume you go to see a physician, a psychiatrist, who prescribes you an SSRI like Prozac or Paxil, any one of those for your depression. The problem is that these drugs have side effects, and one of the side effects relates to the very symptom of clinical depression. One of the symptoms of clinical depression is, those of you in my clinical class, loss of interest in pleasurable activities, called anhedonia. Anhedonia, not feeling hedonic drive anymore. And it turns out, here you are, already low in libido because you're depressed. Now you take an SSRI like Paxil, actually it aggravates your anhedonia. So there's a huge percentage of people who have that symptom of depression, which is really the result of a side effect of a drug that's being used to treat the depression. How about that? What early in the semester we called an iatrogenic effect.